invite Dr. I invite Dr. Bhaskar Bhatt, one of the senior most homeopaths from from Ahmedabad, and also he is one among the seniors among us on the editorial board of NJH, leading like a light till since its inception 1990. He hails from Ahmedabad in Gujarat, graduated DHMS from Gujarat Homeopathic Medical College, Savli, practicing homeopathy since 1977, and actually he is a trustee of Hari Charitable Trust, which runs 6 homeopathic dispensaries. It is a great thing because wherever there is homeopathy, there is a little bit charity, and as a most leading figure in Ahmedabad, he had been there offering people, suffering people with the best of homeopathy, and he is also a trustee of R.K. Desai Samarpan Trust. Has been associated with ISRO, Indian Space Research Organization, and ONGC. From 87, he has been remaining a consultant in ISRO. Elected to the Homeopathic Council of Gujarat in 1983, and in 1989 he became the controller of examinations. Worked as Adhyaksha of Arogya Bharati of Gujarat from 2006 to 2018. Has been associated with Hamai in Gujarat. Right from 1989, he has been organizing Hamai in Gujarat, and then was Secretary General of the Hamai during 2006 to 2010. Became the national president of Hamai in 2014 to 2018, and presently he is the member of the National Executive Committee of Hamai since 1989. Has been continuously hosting organizing national seminars since 1999 in Vadodara, Rajkot, and also he organized 19th All India Homeopathic Congress in Ahmedabad. Welcome, Dr. Bhatt, sir. You are one among the pioneers who has very nicely leaded us in the NJH platform. And since last 14 years, we have been motivating coming generations of homeopaths. And on behalf of NJH, on behalf of our 20th Scintillating Saturday, I invite Dr. Bhaskar Bhatt to present the second presentation in T2 Similimum. Welcome, Dr.
Before we start this, I'd like to talk about NJH also. As you have been told, this is the 20th webinar, and really I'm feeling proud and happy to be a part of NJH team. Our team leader, Dr. Vishwala, is a wonderful leader who brought us all together to work and to share our experiences. Yes? Are you able to listen?
Yes, sir. Yes, sir. Yes, sir. Perfect.
The entire team of NJH is working under the guidance of Dr. Vishwala, Dr. Tiwari sir, Dr. Asrani, Dr. Kasim Bhai, and of course, all other members. We have got nearly 25 members who are working together to run this NJH under their leaders' guidance. And all of you are aware that to convince somebody, two different homeopathic doctors, about as one remedy, or to come to a one remedy by two different school of people is not easy job. It is always, we all say that homeopathy is on base of Similimum, we select the remedy, and everybody is selecting, and everybody's Similimum is different. So we decided key to Similimum as a topic. And this team is working with all different homeopathic practitioners, different thoughts, different school of learning. And that's the beauty of this science. And that's the beauty of NJH, that it teaches us all to learn from everybody, homeopathy from every angle, from different school, and to explore the vast knowledge in a different ways. Kudos to the entire team for doing such a wonderful work. Today we will discuss one of my interesting method of selection of Similimum with a case actually. The topic is key to Similimum, as you are seeing. And we are all very keen to learn shortest way to find out Similimum. That's the idea basically. But it is not always so. As Dr. Pradeep said, it takes a lot of time to understand that how the sim will reach to the Similimum. There are 100 reasons to select a remedy and just one to reject it, or vice versa. So this is interesting. Why it happens that just for one reason, a very senior homeopathic doctor will say that this remedy will not work. Or just for one symptom, he will say this is the remedy and go for it. There are many ways to select the remedy. And different modes are used to prescribe the remedy or to select the remedy and to give it to the patient. Actually, every hardworking and conscientious homeopathic doctor, they have tried to simplify the process of finding out the Similimum. So everyone who is talking on a different way, different platform, different ideas, their basic motto is to find out a Similimum. They are using the Hahnemann's way. They are following the Hahnemann's rule of Organon. But they try to simplify the method, and that's the reason there are different ways and modes of selecting a remedy. Dr. Hahnemann was very clear when he said, or when he wrote Similia Similis Currenter. At that time, hardly 60 remedies were proved. In the Mathematica Pura, we know there are not less than 65 remedies are there. But nowadays, we have got 4,000 remedies. And to select one remedy out of it, this big stock is a big task. It's not that easy. Actually, every sincere and conscientious homeopathic doctor, after years of experience, he developed his own understanding to select the Similimum. Many of them have written books or developed a way to select a Similimum. We'll just enumerate them to understand how different people are using different way to select a remedy. In last actually 1.5 years, almost millions of people in India have been given arsenic cap 30 by thousands of homeopathic doctors all over India. This is genus epidemicus, the Hahnemann's idea of giving a remedy which can help to improve your immunity. And for this particular method, you don't have to think much. Once 10, 15, 20, 30 cases you see, you come out with a remedy which is most Similimum to maximum number of people, and you use it as a genus epidemicus. So this is the one way to prescribe a remedy when there is an epidemic. Dr. Boger Bonningusen, they gave little different idea because they were working together. Dr. Bonningusen was contemporary, and they say that a totality is important. Every symptom should be having a location, sensation, modality, and concomitant. If a symptom is having these 4 parts, then it becomes a totality. And on that base, Dr. Boger and Dr. Bonningusen's Mathematica repertory gives you a clear-cut idea in selecting a remedy from almost 350 remedies that have been mentioned in the Bonningusen repertory. And that is a wonderful. There are a lot of people who have worked on it and they are getting extremely good results. Then there is a third way of keynote prescription. Particularly, Dr. Burnett gave an idea of 3 legs tool. We are well aware, many of you are very senior doctors, that one mental journal, one physical journal, one general modality is enough to find out a remedy. But usually, for this method, these people who are using this method, they are master of Allen's keynote, they are master of Guernsey's red line symptoms, they are master of the NACE. So the book which has been written on keynote, they have learned by heart. Second thing is, they used to have practiced since years. So people who have got 10 years of practice and people who are having OPD of not less than 50 or 100 patients, they use this method very often in charitable trust or in general OPD when they have to tackle 100 people within 4 hours, 6 hours, or 8 hours. There is a fourth way, constitutional remedy, as you have been told by Dr. Kent, and that too particularly, he actually gave us repertory, but apart from repertory, he gave talk on the mathematical, lectures on homeopathic mathematical. He also established a theophilosophical view to treat with homeopathy. His concept to give importance to mental general, physical general, and general morality, and that too with 2 or 3 or 4 symptoms from each, from mental, from physical, and from general morality, that will give up constitution of that person, of that patient, and you can select that remedy. This concept is so popular that most of the colleges, they taught this, and on this particular concept actually, exams are taken, books are written, and this is known that what is the best remedy? Constitutional remedy. We easily say that, but that came from the Kent actually. There was another way, simple reportization. In earlier days, it was difficult, but nowadays with the help of computer, the machine works wonder. You can have input by the 2000 doctors of their experiences, of their books, of their own ideas. Along with that, the original idea of Dr. Kent, Boni Hussein, Borik, everything has been get together in now new repertories, which are on computer. Now this repertorization will definitely, it helps us it brings us rare remedies, special remedies, different approach, different kind of kingdoms. The only drawback is this is a machine. Whatever you feed, it will answer you. If you have got the wrong rubrics, answer will be wrong. So you should be able to make a right rubric with right understanding. Then and then it will help you a lot. But even though with repertorization, you can have 10, 20 remedies and you can study all and find out a remedy. There is another way of giving a remedy, and that is causation. And this method, this particularly causation, is nearer to keynote prescription. You know that he is not well since diphtheria, and you select a remedy, either diphtherinum or some other remedy. Or there is a causation, he is not well after sprain and pain in the leg, and you read it in the mathematical. Rustox is there. So causative factors have got pathology. Apart from pathology, it also works by the.
No fellow fighting.
I think if you can give, I will stop my lecture. Right? Or let me talk. This causation factor works in an acute problems, but at times it works in the chronic problems too. And Dr. Dubey has mentioned causation as one of the paragraph in every remedy in his Mathematica. And there are a lot of other people who have not well since there is a series of books or series of articles. Then there are people who decide the miasm first, and they say the anti-miasmatic remedy should be given first. And that work wonder just in a case of carcinosin, where cancer was there in the history of father. Though it was not exactly anti-miasmatic, but he came out with a remedy which covers the miasm, which covers the entire basic, feeling of the patient, and child improved like anything. There is another way in Calcutta or Bengal's people. They used to give one anti-miasmatic and then another remedy which is constitutional, and then if needed, they may give for mother tincture or biochemic is an additional one. Not everyone is doing it. Few people are doing it, but this is the way homeopathy runs in Bengal since 200 years. And many people in Bengal, every nook and corner will get a homeopathic doctor who will be using this kind of ideas, but not everyone. Then nowadays, in last 50, 60 years, Dr. Vitrugas gave a different idea. He says every remedy can be understood with an essence, the mood of the remedy, the essence of the remedy, the theme of the remedy, and that will give you a better idea if it reflects in the patient. That is the constitution, that is the important remedy, and choose that as a Similimum. He wrote a book also on essence of Mathematica, but only 30 remedies he wrote, and then he went for Viva, which is a big Mathematica. Another doctor, Dr. M.L. Sehgal, he gave a set of books, read this ROS series, read Discovery of Homeopathy. There are nearly 12 books. And they say that every patient expresses by facial expression, by body language, by speech, by tone, by wording, their mental symptoms, which are very important to select the Similimum. Dr. Dhavle established Dhavle School and this integrated clinical research, though I am not all these three people, Dr. Dhavle sir, Dr. Shankran, and Dr. Vijayakar. I listened their seminar, I read their books, but I am not used to be there with them. But Dr. Dhavle's idea or the ICR planning of actually analysis, or you can say working with the different methods and coming out with evolution, analysis, planning, identifying the miasm, identifying the acute remedy, chronic remedy, and the actually even susceptibility, and plan out the entire concept for a long-term treatment. It is one of the best planned way to work, particularly in the institutes, because though you can work in the private also if you are well trained. Then there is a sensation method by Dr. Rajan Shankar. When he came out with sensation method in 90s, it was a sensational change in homeopathic world. And he explained a lot of things in different ways, the different kingdoms, the different miasm. He added 7, 8 or miasm to know the pace of the disease and to understand every remedy by the kingdom and sub-kingdom, etc. And that's why people who are trained under him are working with it to find out a Similimum. Dr. Praful Vijayakar thought about theory of separation, 7 layers. He added genetics to the homeopathic theory, and he also write a book on the acute also, how to select a remedy for the acute problems. All these people actually, they try to simplify the method to find out a Similimum. Their methods work with knowledgeable people, and it is better to learn from every one of them or every school of these thoughts. But basically, their idea, they are with the homeopathy in the same way Dr. Henneman said, that you are supposed to take single remedy, you are supposed to select the potency, you are supposed to think about Similimum, and you will be waiting till the result comes. You will be using only potentized remedy and no other things. So basic idea of homeopathy that Dr. Henneman gave in the organelle is applicable to every one of them. Every one of them. Their idea, basically, they work to make the Similimum easier. So this is what everybody is doing. And homeopathy is like this, that key lies somewhere in what patient says to us. And that is the most important part. Usually you select a remedy on the basis of Similimum that everyone says in every school. But you have to observe that it differs due to the acuteness or the chronicness of the illness as well as presentation, how they present the case. The patient represents his problem in a peculiar way. And that is the real key to go to the Similimum. I will just enumerate few important points and then we'll go for a case actually. The important things are the chronology of symptom. In what chronology symptoms are coming out? Evolution of diseases. In what way the patient is suffering and his diseases are coming out. The intensity of symptom or peculiar symptoms which are very peculiar to the patient, peculiar, clear, rare symptom. Acute or chronic problem. Mind and physical symptoms, most important one. Modalities and causation. If you can grip on these things, you can reach to the Similimum at ease. Any method you use, ultimately, these are the things which you are supposed to utilize in selecting a remedy. And whenever you are making mistake, what happens? I will show you a case actually where mistake starts and then the things happen. So we begin this session of learning with a case. This 5-year-old girl actually was brought to my clinic on 2nd August 2016. She was studying in senior KG. Her father is advocate. So he said, doctor, I will give you a chronological story of my daughter's problem. I said, okay. So this is what father's word. First episode when she had fallen in 2014, she had a fall from the stairs. There was external injury, but after 2 days, she started having abdominal colic. We got her checked. In that, we came to know that her amylase level and lipase level were higher. So further investigation were done. USG abdomen reveals pancreatitis. This is the doctor's prescription at that time, 30th July 2014. And she was at 3.5 years. They say acute pancreatitis was the problem they diagnosed. They advised for the CT scan of the abdomen. This shows that acute pancreatitis likely to be traumatic in view of the history of trauma, according to modified CT severity index 4. No evidence of complete transaction. So it was a cutoff, but there was an injury. Superficial transaction cannot be excluded at this juncture due to edema. There was an edema around the pancreas. So that was the case, and she was in a lot of pain at that time. Then they say they gave medicine, painkillers, antibiotics. It is talking, please. The parents said that with allopathic medication, pain was subsided. Again it occurred, again we had gone to him, again the same medicine, it was subsided. In July 2015, after an year, she was playing at home. While playing, a boy of heavy build fell over her. And at that time, she complained in shaking voice that she is having same pain or serious pain. We went to the doctor, got the investigation done. This time pain was very severe. She was crying. She used to turn side with hands on abdomen, just keeping her hands on the abdomen with prominent tenderness. She wasn't allowed to touch, and that was her condition at that time. So the report where serum amylase came out 3000, we should be below 90. Serum lipase 10,000, we should be below 300. And she was admitted to that hospital for a day or two. She was given painkillers and anti-inflammatory and other medications. And then doctor said, after 3 months, 4 months, in February 16 that you should go to Bombay. So we went to Mumbai on 9th February 2016.
Tomato juice.
No tomato juice, please. So patient is serious. She cannot bear tomato juice. In Mumbai, they advise for stent. They said that your pancreas actually is closed and pancreatic juice is not coming out, and so there is inflammation and there is a pain. So we should go for a stent. When they did laparoscopic surgery for that, they found out this is not here, but they told afterward there is a duct was divided in two parts. And one of the part then entered the stent actually. They put the stent over there. And they told that once she is feeling better, inflammation goes down, you come after 15 days and we'll remove the stent. Again, we went to Mumbai. Doctor preparing for the procedure, but they found that stent has gone. So that stent was removed actually. So surgery was not performed. They said this is the condition, and there is another doctor in Hyderabad. So we went to Hyderabad also and showed it to somebody, some gastroenterologist, and they also said that now stent is not needed and just take care. At that time, in January, the reports are like this. They did also PTH, parathyroid hormone, which was 29 normal, but serum amylase was 400, which is much higher than the 90 needed. Calcium was also normal. The pain which used to occur from September 14 to January 16 used to be continuous, severe in intensity, and it comes frequently every month, month and a half. And every time for 3-4 days or 7 days, she was not able to attend the school. She used to hold her hand on abdomen due to pain, remain inactive, quiet during the episode. She was unable to drink water during that phase even. She never had a vomiting till now, just episode of pain. On 2nd August 16, she was brought to our clinic. At that time, the patient father said that most of the time her pain comes in the morning, 5 to 6 a.m. In sleep only, she should sleep and then she is having pain and she wakes up. Now we have learned whenever there is pain, we start with liquids only, we stop all food, and gradually a day or 2 or 3, pain subsides. We have admitted her in hospital 3 times until now. We took our history, physical general, she desires sweets, bowels 2 to 3 times per day. She doesn't like to sit for a long in loo, and when she sits for a long time, she develops leg pain. She has a sound sleep. Sometimes she sleeps for 3 hours in the afternoon. She generally prefers to sleep on right side. In later half, she will be roaming in the whole bed. She has a habit of putting things in the mouth, nail biting, hanky, sleeves of shirt, etc. Now, when they came to my clinic, there was not much pain, but they wanted homeopathic medicine so that this recurrent pancreatitis can be stopped. So child was also there, a very lively child. We'll just see it. In the past history, neonatal jaundice. After 5 or 6 days of birth, she was kept under UV light. She had a typhoid at the age of 2 years. She suffered from typhoid after 1 week of typhoid vaccine. At that time, she was admitted in the hospital for that. Father is advocate, mother is housewife. In the family, there is a cardiac complaint and hypertension to maternal grandmother and paternal grandparents. Even maternal grandmother had joint pains and vitiligo. That was the history in family. Patient as a person, she has good grasping and learning capabilities. She learns poem within a day. And when mother was telling this to the doctor who was taking history, patient soon started singing a poem. Then mother said she is good at making stories, fake stories. She is good in dancing also. So again patient said, should I dance now? I can dance on any song. Mother says she sings also. She remembers every advertisement, the jingle, And patient now started singing the jingle of various advertisements. Patient to doctor, the one who was writing the case, let me teach you how to write D. She further asked doctor, how much more you will write? This is too much. Mother said she doesn't like to do her homework. She doesn't like to sit at one place for a long time. She is a bit moody. If there is mood, she would finish her homework immediately. Otherwise, she won't finish it. Mother said she doesn't like to tie her hair. She generally opens her hair in the school. So we send her school with so much difficulty as she doesn't like going school. She's making stories for not going to school. Anger, when things doesn't occur according to her wish, she gets angry and irritable. She throws things in anger. If we scold her or beat her, she in turn would beat us. Patient said, I can slap anyone in anger. She screams in anger presently. She is 5 years old. She likes to touch others in form of love, will pull cheeks of those whom she likes a lot. Her last report was of 16th March, and they say this is a discharge summary from the hospital: recurrent acute pancreatitis, incomplete pancreatic division, pancreatic spectrectomy, and PD stenting done, which was failed afterward. And this was the discharge summary before she came to us. At that time, her serum amylase was 580 and serum lipase was 19,000. That was on 18th April. So with this, they gave discharge, and because there was no pain, and she was given whatever medicine they gave, but it didn't work. Every month or even in 15 days or 1.5 months at times, she was getting pain. So we choose the various rubrics. First thing was she was keeping her hand on the actually abdomen. So generally it is supporting a part ameliorates. Then abdomen pain worse by motion. Abdomen pain in the morning 5 to 6 a.m. she used to get severe pain. Then mind was inquisitive. She was very curious. She is loquacious. Mind restless in children. She is capricious, desire to sing, desire to dance. And she was boaster, making stories. So with this, we went to repertory. This was the repertorial chart, where you can see all 11 rubrics are covered by only one remedy, that is lachesis, which is number 2. Other remedies nearer to it, belladonna, hyoscyamus, and veritramal, and lycopodium. All other remedies are much less in number. The way we look at her, the way she was lively, talkative, extremely loving, you can say friendly nature, we think about an animal remedy, and lachesis was selected. We gave lachesis. Her pain was at that time, whatever little bit was there, she felt better. But on 15th August, father came that she has got the pain. We gave lachesis 1 ml in water, 3 pills in a cup of water, and to take 1 teaspoonful every hour till pain subsides. And that helped actually, gradually pain subside. On 14th September, again, there was a pain. We repeated. 14th October, again repeat. So every month she was getting pain. Intensity was little lesser and pain was controlled with lachesis. Then December 16, again in the December, she get 2 times such, and they are going out actually for a tour. So they took SOS remedy with them when they are going out for a tour. In February also she get pain. In March actually, there was a sweet she ate actually, there was gastric problem, pain and flatus was there. And lycopodium I gave to the child as a complementary to lachesis. That gastric problem had gone, but pain again came in May actually. Again I gave lachesis, but this time the pain, they asked for the SOS, which they took almost on every 15 days till 10 July. Used SOS every week even at times. So we said bring the child, we should think differently, because this is nearly 9-10 months and still she is getting pain. Though intensity is less, pain is controlled by lachesis, but she is not cured out of it, or pain is not removed totally. On 20th July, since 2 months recurrent pain was there, the T is missing, severe pain, patient lie down, then they brought her to my clinic. She was just actually unable to bear the pain. She didn't sit in the chair, she lie down with her hand on the abdomen. And then I studied the case again from the beginning. I said, for something is missing. With reference to earlier episode and 2 times soft tissue injury, I think, oh, I'm missing something. Her injury is important, which was external, and there was no bleeding from outside, but that has created problem in the abdomen. And so we changed the remedy, Bellis perennis. Bellis is a remedy for soft tissue injury inside in the abdomen or any other organs, and externally there is no wound or nothing serious. With Bellis, she was feeling much better, but after 7 days, there was a recurrence of pain with lesser intensity. I repeat Bellis. On 2nd August, it was almost 1 year, and she said, doctor, after in these 3 days, my pain went away within hours and I'm better. Parents were very happy. So I advised you should go for investigation, go for the blood test at the CT abdomen. The child refused. I won't go for blood test. No syringe, no blood test. But I convinced her that forget blood test, at least go for the CT abdomen. This was the CT abdomen on 3rd August. And I talked to the radiologist also. They say compared to the earlier days, earlier CT scan, she is better. Mildly altered course ecotexture of pancreas, no evidence of peripancreatic free fluid or change of acute pancreatitis, mildly dilated pancreatic duct measuring almost 4 to 5 mm with few internal calcification, calculi may be there within, few mesenteric lymph nodes in midline, and RIF, right, inguinal fossa. So they say that comparatively she is better compared to the last year. We continued this medicine whenever the pain occurs, not otherwise. It was working. No more episode of pain after 29th August 17. We give SL and Bellis perennis as an SOS whenever the pain occurs. She didn't have such episode. In January 2019, father reported that she is absolutely normal. We had that video had taken, which I'll show you. And I told him for blood test and CT scan. He told that doctor is not ready for the report, but I will try my best if that pain occurs, not otherwise. His parents are advised for regular blood test every year, but they didn't do it. But this year I insisted, I want to present this case and give me the report. And this is a report. Serum lipase is 30 and amylase is 38. Both are in normal values. And since 1 year, she had not come personally, 1.5 years. They are absolutely happy with this. Her video is there, which I'll show you, but before that, let's talk about Bellis. It is there written in everything. Dr. Vitulkas have mentioned that Bellis is an important remedy for deep traumas, whether they may be of the physical body or even the psychological side. It is a remedy that should be considered whenever mistreatment or hurt has been suffered in deep parts, when the physical body has been cut up in an abrasion or hurt in an accident even. In this remedy, there seems to be a predisposition for the tissues of the muscular system and the tendons to be in a precariously weak and tired state. The imposition of an injury on such an organism will almost inevitably result in a deep trauma, a chronic condition that will take a certain form. In other mathematics of Borig or Allen-Skinner, everywhere they have mentioned that injury, slight injury, but the deeper part of the abdomen are traumatized, and that is the typical indication for Bellis perennis. We'll go for the video.
અઢી વર્ષની જેવી હતી
It is in Gujarati, but I will show you the English version.
જવાથી એને
Written
પેટમાં
one.
2 દિવસ પછી દુખાવો આવ્યો એટલે અમે એની જે જનરલ પીડિયાટ્રિક હોય એની પાસે ગયા ત્યારે એને પેટમાં પછી સીટી સ્કેન કરાવ્યું તો રેશિશ આવ્યા એના પેન્ક્રિયાઝ ઉપર સ્વેલિંગ આવ્યું એનું એમઆઈ ટાઇપેસ ઘણું વધી ગયું એટલે હવે આ ટ્રોમેટિક પેન્ક્રિયાટાઇટિસ છે ટ્રોમેટિક પેન્ક્રિયાટાઇટિસની દવાઓ શાંત થઈ ગયું પછી પાછું લગભગ એકાદ વર્ષ પછી ફરી એને અચાનક પેઇન ઉઠ્યું અમને જ હતું કે આ રિકરન્ટ થયું પેન્ક્રિયાટાઇટિસ ફરી પાછું એમાં ડાયાબિટીસ વધારે તપાસ કરવાથી ફરી અમારે એ થયું ત્યારે ટ્રોમેટિકલ ના આવ્યું પણ પેન્ક્રિયાટાઇટિસ આવ્યું હવે કેમ આવ્યું ખ્યાલ ના આવ્યો ધેન આફ્ટર રેગ્યુલર ઇન્ટરવલ પર 2-3 મહિને અચાનક થવા લાગ્યું પછી અમે એની જે ઇન્વેસ્ટિગેશન થતી હતી એલોપેથીમાં એ કરતા હતા પછી એકવાર એમઆરઆઈમાં એવું આવ્યું કે એની જે પેન્ક્રિયાટિક ડક્ટ છે એની અંદર 2 ડિવિઝન છે એટલે એક ડિવિઝન છે જેમાં 2 આવે છે એક રેગ્યુલર નળી છે મોટી એક સાંકડી નળી છે એટલે એવું વિચારમાં આવ્યું ડૉક્ટર્સને કે એ જે સાંકડી નળીમાં જ્યારે પેન્ક્રિયાટિક જ્યુસ જાડો થઈ અને અટકી જાય છે 15 દિવસ રહીને અમારે પાછું જવાનું હતું સ્ટેન્ટ પાછું કઢાવવાનું ત્યારે ગયા ત્યારે જ્યારે એક્સરે કર્યો ત્યારે ખબર પડી સ્ટેન્ટ નીકળી ગયું છે એટલે ઓટોમેટિક જગ્યા પોળી થઈ ગઈ છે પાછા આવી ગયા અમદાવાદ પાછા 15 દિવસ રહીને ફરી પેઇન ઉપડ્યું એટલે તપાસ કરીને ત્યાં વાત થઈ કે કદાચ સ્ટેન્ટ બરોબર ન લાગ્યું હોય અને તકલીફ થઈ હોય એટલે પાછા આપણે સ્ટેન્ટિંગ કરી જોઈએ સ્ટેન્ટિંગ કરાવવા ફરી ગયા ત્યારે પાછું એનું ચેક કર્યું અને એન્ડોસ્કોપી કર્યું ત્યારે ખ્યાલ આવ્યો કે ના તે જગ્યા બરોબર પ્રોપર પોળી થઈ ગઈ છે એને હવે સ્ટેન્ટિંગની જરૂર નથી એ ડિવિઝન 2 ક્લિયર થઈ ગયા છે ક્યાંથી જ્યુસ જઈ શકે તો પણ પછી મટ્યું નહીં એટલે ફરી પાછું અહીંયા આવ્યા પાછું એમઆરઆઈ આ તે બધું હંમેશા એનું કરતા રહ્યા પછી હૈદરાબાદમાં ડૉક્ટર નાગેશ્વર રેડ્ડી છે
એમના સ્ટેન્ટિંગ કરાવ્યા પછી તો એવું થયું કે જે ડ્યુરેશન 2-3 મહિને પેઇન થતું હતું એની જગ્યાએ 15 દિવસે મહિનાની અંદર 2 વખત થાય અને પછી તો એવી સિચ્યુએશન આવી કે 1-1.5 મહિનો સતત પેઇન રહે
પેઇન કેવું હતું
ભયંકર થાય છે
પેઇન એનું ભયંકર અચાનક રાત્રે શાંતિથી ઊંઘી ગઈ હોય રમતામાં જો મસ્તી મજા કરતા અને 3-4 વાગે 5 વાગે ઉઠીને ચીસો પાડવા લાગે બહુ જ દુખે ને અકળ વકળ થાય આમ તેમ થાય આવડતી હોય સ્કૂલમાં હોય સરસ રમતી ગઈ હોય ત્યાંથી ફોન આવે એને દુખે છે બહુ જ પછી અમે હૈદરાબાદ ગયા તો ત્યાંથી પછી જીનેટિકલ પેન્ક્રિયાટાઇટિસનો એક જીનેટિકલ રિપોર્ટ થયો અને એમાં એમણે ડાયગ્નોસિસ કર્યું કે ઇટ્સ જીનેટિકલ પેન્ક્રિયાટાઇટિસ પણ પછી બી એમણે કીધું કે હવે અમારી પાસે એનો જીન થેરાપી નથી ડેવલપ થયેલી ધી એન્ડ ઓફ એલોપેથી પછી અહીંયા ડૉક્ટર ભાસ્કર ભટ્ટ સાહેબ પાસે અમે આવ્યા સ્ટાર્ટિંગમાં થોડું અમને તકલીફ રહેતી હતી હમણાં છેલ્લા 6-7 મહિનાથી તો ખૂબ જ સારું છે કેવલ આને પેઇન નથી
અહીંયા તમે આયા લગભગ ઓગસ્ટમાં આયા 2016 ઓગસ્ટમાં આવ્યા તમે બરાબર તો એ ગ્રેજ્યુઅલી શું ફરક પડ્યો તમને
ઓગસ્ટ 16 થી આવ્યા અને જુલાઈ 17 સમજો એક વર્ષ સુધી અમને થોડો થાય અને એક ડ્રામેટિકલી અને મેજિકલી 2 રીતે સરસ વસ્તુ છે કે અમને જ્યારે દવા પેલી રહેતા હતા એલોપેથી જ્યારે પેઇન ઉપડે ને તેને 1-2 દિવસ થતા હતા મટતા એને ખાવા પીવાનું બંધ થઈ જાય પાણી પણ બંધ થઈ જાય અને એને પેલું બોટલ ચડાવી અને એને હાઇડ્રેટ રાખતા હતા પણ અહીંયા આવ્યા પછી એ દવા જે આવે છે એનાથી એને લગભગ 24 કલાકથી લઈ અને 3-4 કલાક સુધીમાં જેનું ડ્યુરેશન કરતા એનું પેઇન મટી ગયું છે
ઓકે એટલે પેઇન થાય તો 3-4 કલાકમાં કંટ્રોલમાં આવી જાય
24 કલાક પહેલા દિવસે પહેલી વાર 24 કલાકે મટ્યું સમજો એ ઘટતા છેલ્લે 4-5 કલાક સુધીમાં મટી ગયું હવે છેલ્લા 6 મહિનાથી તો એને પેઇન નથી જ
છેલ્લે 6-7 મહિનાથી તો બિલકુલ નથી પેઇન થયું ટચવુડ કે અને ધીમે ધીમે
એપેટાઇટ કેવી છે હવે
સરસ છે એકદમ
ઓવરઓલ એની ઇમ્યુનિટી પણ આ મેડિસિન્સ પછી ઓવરઓલ ઇમ્યુનિટી જે બાળકો એમને જે બીમાર પણ પહેલા એ બીમાર બી વધારે પડતી હતી શરદી ખાંસીનો બહુ પ્રોબ્લેમ થતો હતો વાયરલ ઇન્ફેક્શન વારે ઘડી લાગી જાય એ બી હવે એને ઘણું સારું છે એમાં પણ ઓવરઓલ સારું છે
અમે તો બહુ જ ખુશ છીએ બહુ
અમારી માટે તો શું કહેવાય કે એક જાણે ભગવાન ઓવરઓલ એની ઇમ્યુનિટી પણ પણ આ મેડિસિન્સ પછી ઓવરઓલ ઇમ્યુનિટી જે બાળકો એમને જે બીમાર પડે પહેલા એ બીમાર બી વધારે પડતી હતી શરદી ખાંસીનો બહુ પ્રોબ્લેમ થતો હતો વાયરલ ઇન્ફેક્શન વારે ઘડીએ લાગી જાય એ બી હવે એને ઘણું સારું છે એમાં પણ ઓવરઓલ સારું છે
અમે તો બહુ જ ખુશ છીએ બહુ
હા અમારી માટે તો શું કહેવાય કે એક જાણે ભગવાન જ છે અમને
2 વર્ષ બહુ દોડ્યા છે બહુ આખું ઇન્ડિયા ફર્યા છે કોચીન મુંબઈ લખનઉ દિલ્હી હૈદરાબાદ
જ્યારે બાળક એટલે અમારી માટે તો મને અત્યારે યાદ આવે છે તો બી રડવું આવે છે અમને એવું નતું 2 વર્ષ પહેલા કે અમે અમારા બાળક માટે અમે એને ગુમાવી દઈશું કે શું એવી પરિસ્થિતિ હતી અમારી એટલે અમારી માટે તો અત્યારે સાહેબ ભગવાન છે સારું છે
So this is what they told, that it is as good as a God-sent medicine which has worked wonder. This is what they have told in the, this is the English actually roughly of whatever they talked about. So this case shows that with all other ideas, I was not able to reach to the Similimum. But that causative factor worked wonder with me, that why did she develop this problem? And then Bellis Perennis almost stopped pain at all, stopped every inflammatory changes, stopped everything. Overall, her health improved. So think that apparently she was lacusis. The rubrics that we choose were all lacusis, but it didn't cure. The cure came with Bellis Perennis. I hope you have got enough time. I'll go for another small case. It is not a small case, but it's an interesting case. This is another case of a 14-year-old girl. She came to our clinic on 9th May 2013. She was a known case of intracranial space occupying lesion with hydrocephalus. Patient had severe throbbing headache, and she wanted my headache to stop. Now for this, what they did, just let us see. For the above mentioned complaint, they consulted a neurosurgeon. They advised for MRI. MRI report on the 2nd March 2013 showed heterogeneous enhancing altered signal intensity, and ultimately it was the neoplastic glial lesion in the tectodiorama, likely over the ependyoma. So there was a small brain tumor in the near the 4th ventricle, and they say that this is the reason she is getting pain. So in the past history, before 2 years, in April 2010, patient developed alopecia areata near the ear. It spread on the entire scalp. She took some Ayurvedic treatment for 2-3 months. Complaint increased. Then they consulted a dermatologist, took treatment from the doctor. In between, her period became irregular. Then they went to a gynecologist, and USG abdomen shows, ovary shows multiple follicles, PCOD diagnosed, large follicle measures 9 mm to 8 mm on both sides, or at times 7 mm. So what happened was, her scalp was having skin problem, alopecia areata, followed by some treatment, and then she developed PCOD. She was born in 98, born and brought up in Ahmedabad. Parent used to take care of me nicely. She had given her history on her own actually. She's almost 15 years. I was quite obstinate. It's like if I want something means I want by any means. And I was very obstinate. I feel that my younger brother gets things very easily and fast whenever he demands, and I am not getting it. There are photographs and videos of his birthday celebration, but there is not a single photo or video of my birthday celebration. I am not jealous of him, but I used to get these thoughts off and on. I love dancing. Nature-wise, parents say she is good, easily mixes with others. She said I can make friends easily, but people used to diss me. I became irritable and short-tempered after this problem. I am angry because doctors cut my hair. I used to get angry on small things. For example, if food is not of my choice, when brother don't allow me to watch the TV, etc. In such situation, I start shouting, throw away whatever comes into my hand. I never cry. When my mother beats me, I cry due to pain. She's getting unusual dreams, don't remember. Get dreams of witches walking beside me. Fear of height. Heartbeat increases when I used to look down. I'm always confused when to take decision. I cannot choose between two shirts. I always have to ask mom what to wear. She is very lazy in doing work. I don't mind if things are haphazardly placed in my house. Happiest moment when once mom gave me a surprise party and surprise gift on birthday. I was happy. Saddest moment when I realized that I am suffering from this complaint, and I was told that there is a problem in the brain. So that was the saddest moment. And as such, I wanted to become a doctor. When I realized that I have this kind of problem, now I feel that I should go for neurosurgery. She wants to be a neurophysician now. School, she could not control her urination, so she felt bad about it in the school once. I am tensed for the next operation. It is very risky. Relative asked doctor for opinion for second surgery. Role of homeopathy in this case, opinion of chemotherapy, radiotherapy, etc. So once she had already been operated, and now doctors say we may go for second operation. She is bold, independent, want to come out of this, want to grow in life, self-confident, sibling jealousy, guilty feeling, sluggish, guilty feeling for her anger or for her jealousy for the brother, sluggish, sympathetic, easily mixes with others, intelligent. Constitutional or physical sexually appetite normal, like spicy and biscuits, aversion to sweet, occasionally constipation, otherwise everything is normal. Menses irregular, 5 days a week, cycle 45 to 60 days, she has got PCOD. Father is 45, mother 43, she is the second sibling. There is a family history of heart disease, rheumatism, diabetes, allergy, asthma. So we took these rubrics: mind obstinate, headstrong; mind jealousy between children; mind indolence, aversion to work; mind irritability, fear of high places; irresolution, delusion is neglected; mind eruptions or hemorrhoids, mental symptoms aggravate after, suppressed. What I felt is her skin problem in the scalp was cured, and then she developed everything. So I took this rubric: mind, it is in the mind, eruptions or hemorrhoids, mental symptoms aggravate after suppressed. With this chart, actually, the first remedy came by argenticum, but out of the chart, actually, these photographs are there. I hope you are able to see the entire chart. The last remedy in the chart is ginkgo biloba. It is the last one. So William Borick says, repercuss eruptive disease, this is a wonderful remedy. Dr. Clark writes, there is another kind of nerve poisoning made by ginkgo, the poisoning of suppressed eruptions or discharges. Even in other Mathematica, it is mentioned that suppressed skin problems lead to the nervous problem. Ginkgo is a first choice of drug. So even in the repertory chart, it was at number 10 or 11, I choose ginkgo biloba. On 10th June 13, we started ginkgo biloba. She was feeling better. You'll see it. Even in 15, we gave in between Similimum and carcinosin as a miasmatic or even thuja also. But basically, ginkgo was a remedy. Her periods become regular. Actually, from March 15 onwards, she was getting periods regularly. This was earlier at times very late. 5th, actually May 2014, her reports were done, and they say, I'll just come out of it. They say subdural collection along bilateral cerebral convexities more on the left side compared to the previous MRI. There is seen mild reduction in craniocaudal extent of the lesion with no evidence of hydrocephalus on present study. There is seen reduction in high right subdural collection with increase in left-sided subdural collection. So Dr. Radiologist said that she is improving radiologically. Again, after 1 year, gone for the MRI, heterogeneously enhancing lesion, knowing scactal plate, Pineal gland with extension as described. Small subdural collection is there. Minimal diffuse patchy meningeal arrangement near all static sites of lesion with reduction in patchy meningeal enhancement and size of subdural collection as compared to last MRI. So it has been now static. Since 1 year, there is no actually deterioration. Again, they had gone to the doctor, which is not been mentioned over here, to that neurosurgeon in Bombay. And he said, your lesion is not active. There is nothing serious. Don't go for surgery. Now you don't need surgery. Watch and wait. And since then, her headache is not there and periods are regular. I said, whenever anything goes wrong, you contact. But she's doing really good overall. No pain, nothing. Why this is important is that this is an again causative factor. Suppression of stimulation lead to the problem in the brain and problem in the actually ovary. She developed PCOD as well as brain tumor. And both the things, unfortunately, we treated after 2-3 years. That happened in 2010 and she came to us in 2013. So even though our medicine has worked to a great extent and they were very happy that there is no pain and periods are regular, she's doing good in the study. Mentally, she's much better. So this is the beauty of homeopathy, that what you can do. The same, I'm just giving you a few interesting such kind of cases from Dr. Nash or Clark, their testimonial in the clinic. This is a book written by Dr. Nash. A child with obstinate dysentery and several doctors failed. Dr. Nash just noticed one symptom when mother changed the diaper, that anus is wide open. Just with one symptom, that has been mentioned by Dr. Lippe also in the Mathematica, that this is a phosphorus symptom. Child was given phosphorus and the dysentery has gone. With that one remedy within 3 days. Even Dr. Stuart Close had written one case where woman had cutting, burning pain in the balls of the feet, right? Heel pain. On stepping, on standing with the most of the weight on heels only, there was no pain. So when she stand with the pain on the heels, actually, no pain. Otherwise, there was severe pain. On this particular symptom, he chose Berberis vulgaris, no other constitutional remedy, and patient was cured. Even Dr. Clark writes a case actually. I once cured a case with few roses of crocus, a young artist who had become a subject to violent outburst of rage in which he would take up a knife to throw at his mother with whom he was living, and almost immediately after he will repent. So there is a rubric, anger followed by repentance. With just one rubric, Dr. Clark gave this remedy and that artist was much better after that remedy. So these are the various keys where keynote prescription, where causative factors, where rare things, and you just, if you don't look at it with seriousness, you may not be able to find out a right Similimum. So homeopathy is really, really wonderful in this way that we are getting many things from just observing, understanding, listening properly. Your eyes, ears should be open when you are taking case, when you are talking to the patient. Small things, you should take care that they are basically they are very important points which they just simply tell. Yes, I had an injury. Yes, I had this problem. Yes, I got very angry, but then I repent actually. And you realize afterward that you missed that part. So if you're a keen observer, keen listener, and keen taking note of everything, you will realize that key to the Similimum is not always one or second or third or fourth, actually, you can say manner, but it can be something different even. So best part what Dr. Pradeep said, you should be a keen listener, keen observer, unprejudiced, that is the most important. If you are prejudiced that, oh, pain, see the pain remedy only, you are out. You won't get the key to the right remedy. So this is the beauty of this science. And I hope today we talked about one of the method which is used by almost very senior people, stalwarts, in a wonderful way. And we want to draw your attention to this particular part so that you can understand the importance of positive or keynote symptoms or some important background of the past as a key to reach the Similimum. I am thankful to all of you. Thanks to the NJH team, Dr. Vishphala, particularly, those you may not like it, but really, she being a good leader, she developed not many people to work together, and that's not easy. To bring two people to one idea is difficult in homeopathy, and she brought 30 people to bring one idea of NJH to run, which is running with an idea of learning only. So in NJH, you will get everything. Everything is from one school of thought or another school of thought, or in the past history, or in the positive factors, or in the rare remedies. Everything is there with the NJH. They try to see that maximum material should be given to the people so that they can learn various things. Apart from magazine, this journal, NJH has got few more activity. Every Tuesday, Telegram, there is one case, there is a discussion by the various students and various doctors, and then ultimately the solution, the key is given by the person who has presented the case, a senior person or a part of the NJH team. Same way, on every Saturday, NJH bites are placed on the NJH online or everywhere, and this NJH bites prepared by Dr. Rama and Dr. Lata is wonderful. There are old cases of NJH. They have got a big library, or you can say large number of cases of various things, which they place one by one to learn. Same thing about this, they have got a book club also. NJH actually is doing this activity of seminars and webinars now. Earlier it was seminar every year. Now it is a webinar for this year because of the corona. So all this NJH online is also there. So I will say those people who are not used to it or who have not subscribed this, they should subscribe it. This is good for learning. And thanks to Dr. Shaji, Dr. Pradeep, the entire NJH team, and thanks the listener for giving me an opportunity to share my ideas. Thank you very much.
In short, I will say, sir, Bhaskar sir,
Yeah.
NJH is a university.
Yeah, good.
So take admission in NJH. You will learn a lot.
Good.
Request to all the participants.
Very good. And now let's have the question answer session.
Yeah.
Thank you, sir. Thank you, Dr. Bhatt, sir, and thank you for the comments by Dr. Pradeep. It is a very, very, very wonderful case. All the case which has been told by both the jewels of from NJH, and now it is the question time. Now it is the question and answer time, and I hope a few persons have raised Dr. Shirish, whether he is on participants, I don't know. Dr. Shirish and Dr. R.J. Chaya has raised their hands, and a very comment from Dr. Adar Jago sir. Jago sir has told that causative modality, Dr. Bhatt sir's first case, causative modality has been highlighted, and it is very, very nice to hear see that, sir, because I remember this trauma. Trauma is a very wonderful topic which can go to up to 2 hours discussion. So I am not opting for that. Anyway, I invite Dr. Pradeep sir. Pradeep sir, come forward. Is there any question towards Dr. Pradeep? प्रदीप गार्गे सर के लिए कोई क्वेश्चंस है? Yes, sir. Carcinosin was a very, very wonderful remedy. It is the most modern nosode we had, and probably if Madam was there, Madam may be talking in a very elaborate way in carcinosin, because I remember in the book in nosodes by Dr. Sarla Sonawala and our Madam. Actually, carcinosin was represented by Yudhishthira, I hope.
Obistar, yeah.
Yeah, not for, it is in the myth, in the Hindu myth, we have a character Yudhishthira.
Yeah.
And carcinosin was represented by Yudhishthira,
Mhm.
while Madarainam by Bhishma and
Okay.
Tuberculinum by Arjuna, and it goes Nagula and Sahadeva representing Sorinam and Similimum. Yeah. So this Yudhishthira character of carcinosin, he holds always the principles. That is what highlighted, and the sense of rhythm. Very another important remedy was there in carcinosin, and Yudhishthira has been mentioned that even when a carcinosin is the right remedy, there happens a fever on the 10th day. It has been observed. On the 10th day, there appears a mild fever, and if such a fever happens, we can assure that the case was carcinosin. A very great remedy. Very great remedy. We have Yudhishthira has come forward. Actually, it was a remedy identified by Dr. Casey Burnett. Burnett actually made the beginning for the carcinosin personality, and Yudhishthira completed it. And in between, we have a name of a Chinese name in that Yudhishthira, and along with Dr. Hui Bon Hua of US, they both represented this carcinosin drug picture. And I hope Dr. Pradeep Darge can comment something more on carcinosin. There is a sense of rhythm. There is modality is better at the seashore. There is blueness of the sclera. There is
that is very important.
Tuberculinum.
Yes. Very important. We miss, as we are discussing, and Dr. Bhaskar sir has given very nice cases of trauma. One of the important remedy, carcinosin, is for headache, which has occurred after injuries to head. And we, most of the time, we miss it. We think of arnica, we think of natrum sulf, but we don't think of carcinosin. And it is given in italics that it is one of the wonderful medicine for headaches, especially after injuries to head, caused after a headache, head injuries. This is wonderful medicine. And secondly, the chocolate.
Yeah.
Many of the patients, that is also one of the important desire for butter, desire for chocolate and eggs, fat fruit, everything is there. And another remedy which we miss, we give Baraita carb, we give Mercosol, but we don't give carcinosin in cases of recurrent tonsillitis. One of the important medicine for recurrent tonsillitis, and we miss it. So, as Dr. Hanuman has said, that we have to go on reading, and prejudices should not be there. That this is Baraita carb, this is mercury.
I may add something.
Yeah, please.
Actually, I had used carcinosin in people with lot of glandular activities or multiple glands, lipomas, etc. in the body. Lipomas in the body, and they have come for another problem. This lipoma, doctor have been told that this is not curable. You have got multiple one, forget it, nothing can be done. But with carcinosin, there are other problems are actually solved actually. Reason is the tendency to have this kind of small tumors, even non-invasive or not non-cancerous. Carcinosin can be one of the anti-miasmatic.
Yeah, and it has been written that it should not be given in the suspected case of cancer, but it can be given in cancer cases, not in the suspected cases of cancer.
No, these are not suspected. These are sure case that they are not cancerous.
Yeah.
They are lipoma only, but multiple lipoma, and they have got some other problems. And when not responded to the remedy, a dose of carcinosin changes their, the entire constitution, and they become much better. So, as an antipsychotic remedy, carcinosin can be used.
Thank you, sir. Thank you, sir. We have another material media doyen with us, Dr. Praveen from Hyderabad. Sir, is there a knowledge material media band with us? Sir, can you comment on carcinosin? I know that it is a one very favorite or wonderful remedy of yours. So please comment on carcinosin.
Actually, first of all, at the very outset, I should really congratulate both the speakers, having done an excellent job of presenting fantastic cases. Earlier in one of the presentations, the causation, as Dr. Pradeep was telling and Dr. Bhaskar Bhatt was mentioning about the causation. Carcinosin, one of the commonest causations which we all ignore, is ailments after sexual abuse. This is a very important point which we have to remember. Most of the young girls who come to us, who will have some problems which they cannot disclose, we have to spend a little more time and have a good rapport. Then they will disclose what has happened. Nowadays, sexual abuse is very common in offices, in buses, everywhere. Now, probably you are watching that Family Man second episode there, that Samantha Akineni gets sexual abuse. So this molestation, these things are common. If they develop, but she kills that fellow in this episode, is different. But if they develop symptomatology, which they are not able to express outside, so that leads to certain symptomatology, then the causation of that can be taken as one of the leading indications for carcinosin. But I should tell you, both cases presented, 3 cases rather, presented excellent, learning, fantastic. The whole NJH team has to be congratulated. Thank you very much.
To add to that sexual abuse, I will add one important thing which we forget, that one of the important remedy for masturbation, whether it is in males or in females, carcinosin is one of the important drugs, and especially masturbation in children.
Very good.
You will be surprised.
Yeah, if medorinum fails, carcinosin works even in this.
It works, right. And another thing which I will like to add is sleeplessness. A chronic sleeplessness, carcinosin. We think of
chronic insomnia, the best remedy.
Chronic insomnia, right.
Exactly. I have treated one case, 25 years. You won't believe, my own principal's aunt, he referred. So I was working as assistant professor, he was principal. We were very close also. He referred his aunt, who did not sleep for 25 years, according to him and according to his wife, her husband. So that case, she yielded to carcinosin. But here I should add one point. When she was completely cured, you may blame me later, I don't know. But after 4 years, I just inquired my principal, what happened to your aunt? How is she? He said, I should have told you, last year she developed severe cancer and died.
Oh.
As if she was proving carcinosin. I don't tell, I will not agree if somebody blames that carcinosin has created cancer. It cannot be created. But carcinosin was indicated even at that level and probably could not prevent cancer being coming on to her body. It could be.
Thank you, sir. Thank you for that great words. And coming to Dr. Bhatt's cases, it was very, very well conceived, and that cases from the classical books of Nash and Nash, leaders in America. And I hope both the speakers have been very, very, very balanced with the key to Simlimum, arriving in the right remedy. There are various rivers flowing jointly to reach sea. That is the way. Saigal School, Shankaran School, Vijayakar School. In Kerala, it is a very nice to see that nobody follows any single school. That is the difference in our state. We have gurus, a lot of gurus for the same person. So all these rivers merge into the sea. And I remember E.B. Nash has very clearly stated that resume of remedies. He called it resume because 3 or 4 or 7 words regarding a remedy itself depicts the drug picture. That was the very wonderful contribution of Nash, very different from other authors. Anyway, Sir's Dr. Bhatt's Bellis Penis case And the second one, Singamet. When we repertorized, we arrived in some other remedy as number one, and the last remedy was Singamet. And depending upon the etiology, that is what Dr. Bhatt has highlighted. Each and every case we have to approach as a blank paper. I hope it was like that. And each and every case deserves as a virgin case. That is the word used by us in here programs. And I hope Dr. Ajit Kukuni has also joined us. Whether Vishali?
Yes, sir.
Yeah, we can invite.
We welcome
Dr.
his
Ajit
comment
Kukuni.
actually.
Yeah.
Dr. Ajit, we are expecting your comments if you
Yeah.
listen.
Yes, sir. We have 3 remedies: Bellis perennis, we have Syngham metallicum, and we have carcinosin as the cases which has been presented so far. Sir, please comment upon.
Yeah, I could not listen carefully to all the speakers, but all the 3 prescriptions, when I started studying the data and the consequent prescription, I think the speakers have hit at the right similimum. And you are able to see the result of this. uh, I think about Belispar, I would like to say that Boger opened a very good issue about Belispar, that it is a greater and deeper Arnica montana. The second thing about Belispar is it is regarded as a remedy which is between Arnica montana and echinacea. You know, this is a remedy of toxicity. This is a remedy where there is a process of toxicity in terms of the fever and some amount of suppuration. So I think that there is a suppuration also in Arnica montana. It is one of the remedy which we use for crops of boils recurrent. It's a remedy for septic wounds also. But when even the sepsis is not responding to Arnica montana, you must think of Bellis perennis, which could complement the action of Arnica montana. This is the idea. Then in Bellis per, what you are able
Yeah.
to see is less soreness in comparison to Arnica. Arnica has more soreness and touch aggravation, which you don't see in Bellis perennis. And if deep organs in the body are involved, it is thought that Bellispur will be a right answer than Arnica montana. So these are the ideas if we make a comparative study between these 2 remedies. I would like to add one more point. The way in which Arnica has to be understood is at 2 levels: hypersensitivity, followed then by hyposensitivity to the extent of insensibility. This is the journey in acute trauma in a chronic personality structure of Arnica montana. At the level of insensibility, the feeling is that I'm okay. Doctor, you can go away from me because I have no any suffering part of this. This is, I think, a anesthetic part of the mind where the senses become blunted and the mind goes into a different level of perception, not to the extent of opium. So arnica is soporous, but definitely lacking the severe insensibility picture of opium. So what I understood is that arnica, Belispur, followed then by opium. This could be the best trio to study, especially the head injuries. So this is my comment about Belispur in short. About Zincum metallicum, I think I have a lot to offer. In our Absolute Mathematical second part, we are giving all the Zincums together. It is only recently that I have completed Zincum metallicum, a very wonderful remedy. And I think this is a remedy, unfortunately, being focused only on the standpoint of central nervous system, autonomic nervous system. Actually, this is a very good constitutional remedy, historical remedy, mostly useful to the females. And this part of the female reproductive system has not been tackled very well in our literature. I think it is a remedy which can be compared with Helonius and Cocculus indicus. I would like to say that when, in a way, we understand Helonius, where there are multiple abortions, multiple use of the female reproductive system, then you will find that a lot of contraceptives have been taken and there is a big load which the system cannot tolerate. So this aspect of the Helonius, when you go with more exhaustion than Helonius, it is Zincum metallicum. And I have to offer you one more relationship which is very important in clinical practice. Medorinum is a very good combination of Zincum metallicum and sulfur. This will give us a lot of entries into neurodermatitis, cases related to central nervous system, cases where we fail with a lot of skin cases and neurological cases also. Recently, I treated a very good case of Guillain-Barré syndrome with medolinum, where the combination of zincum and sulfur was present. It was post-COVID state of Guillain-Barré syndrome. So you will feel that sometimes the relationship of remedy itself becomes a very good tool to give the prescription. So I think today's presentation was very good, but I think this is of course my opinion, and you should not agree with me also if you don't like. But I think we should focus more on the cases and their analysis. Everyone knows that what is to be cured. Everyone knows the points which are very important in the case history. So this is now very much in homeopathy. I mean, given advices by the speaker is very much. So we should control them and we should go into the case, analysis of the case, and consequent interactive group discussion. This is, I think, will create a very good platform for everyone to hang on to engage. This is, I think, now. The time has come. I understand your advice and your guidance, which is mostly needed. But I think now it is over advised by the homeopaths when they act as speakers. So we have to control them.
Thank you, sir. That's a great, wonderful time.
Telegrams,
very,
cases in the telegram, they are really worth because everybody is discussing and learning.
Yeah.
Yeah,
And
so
that's
we
a
have
good
reached the
process that
time.
we are doing every alternate Tuesday actually.
Yes, thank you, sir. Before concluding, I must comment that here at Trivandrum, we had a very remarkable point regarding belly penis. If you get attacked by the police person in the police station and you develop anuria, belly penis is the answer.
I will add to it one thing. Don't give belly penis at night. It is not advised to give belly penis at night. It can cause sleeplessness. A very important thing.
Thank you all for
Like
the
sulfur,
great
like sulfur.
Yeah. Thank you, great
Yes.
teachers and great
Everybody.
personalities assembled here.
Thanks a lot.
Thank you for Dr. Vishali and Dr. Shobha Shah for organizing behind the screen, and thank you
Yes.
for Madam controlling everything along the mobile, and thanks a lot for the 147 participants who have come to the program, made it an average group for NJH Scintillating Saturdays. Thank you. Thanks a lot. We will meet again in the editorial board. Thank you. Thank you all and everyone.
Thank you very much. Thank you very much, sir.
Thank you very much, everyone. We'll join again on 26th of June.